Center COVID-19 briefing for Wednesday, the 16th of June, 2021. I thank you very much for joining us today for our briefing. Of course, you know that your company at these briefings, online, whether you're on TV, watching TV, listening to radio, or you're on social media, we thank you very much for being with us. We continue to update you on what is happening in St. Kitts and Nevis with respect to the COVID-19 pandemic. And as we can see here in the Federation, the pandemic is not weary yet. The pandemic is still well and alive here in St. Kitts and Nevis and in other parts of the world. I would like to invite first to the podium to address us the Honorable Attorney General, Honorable Vincent Byron, Jr.
Thank you very much, Lesroy, and good afternoon to all our viewers and listeners here in St. Kitts and Nevis and further afield, wherever you are. Yesterday, the 15th of June, 2021, His Excellency, the Governor-General, Sir S.W. Tapley-Seton, by proclamation, declared a state of emergency for St. Kitts and Nevis. The state of emergency shall be in effect from 6 p.m. on Tuesday, yesterday, 15th June, until 11:59 p.m. on Tuesday, the 6th of July, for 21 days. A state of emergency or emergency powers is a situation in which a government is empowered to be able to put through policies that it would not normally be permitted to do for the safety and the protection of their citizens. A government can declare such a state during a natural disaster, civil unrest, armed conflict, medical pandemic or epidemic, or other biosecurity risk. We here in St. Kitts and Nevis, over the past few weeks, have been faced with an outbreak in this global pandemic of COVID-19. And we have heard from our medical team, we have heard from a wide range of people that we need to have it under control, to get it under control. And so the Governor-General, on the advice of the Prime Minister, has issued this state of emergency to do so. We will be hearing later in this briefing from the medical team who will indicate the numbers that have led us to have to take this action. We'll hear from Superintendent Henry, who will describe and detail the emergency powers regulations that will now be in place. For the most part, they capture those that are already being promulgated, but they do tighten the restrictions that we have. Underlying all of this, the Cabinet, the Prime Minister and the Cabinet have been advised that to get a hold of this outbreak here in St. Kitts and Nevis, we need to have people stay at home, to be restricted in their movements so that they cannot transmit the virus. One of our medical experts likes to say, if people move, the virus moves. People do not move, the virus does not move. And so we have heeded that advice, and have requested His Excellency the Governor-General to do so. The proclamation of His Governor-General is based on the Constitution of St. Kitts and Nevis, and is based on Section 19, subsection 1 of the Constitution that sets out that the Governor General may be able to make such a declaration. I should point out that it is also based on the Emergency Powers Act of St. Kitts and Nevis, which also sets out the basis on which this state of emergency is made. And I should just point out that this is seen in Cap 19.02 of the laws of St. Kitts and Nevis, that where it appears to the Governor General that a public emergency has arisen as a result of the imminence of a state of war between Her Majesty and any foreign state, or as a result of the occurrence of any earthquake, hurricane, flood, fire, outbreak of pestilence, outbreak of infectious disease, or any other calamity, he or she may declare that a state of emergency exists and that the declaration is reasonably justifiable in the interests of defense, public safety, public order, or public health. And it's under this legislative framework that His Excellency has issued this declaration. Thank you very much.
Thank you very much, Honorable Attorney General. I recognize the presence among us of the Prime Minister, Dr. the Honorable Timothy Harris. I would now like to invite Superintendent Cromwell Henry to update us on the new regulations.
Thank you very much, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. As you would have just heard, new regulations under the Emergency Powers Act have been published by His Excellency the Governor General, having declared a state of emergency in the Federation by proclamation dated June 15, 2021. This state of emergency runs from June 15 to July 6, 2021. The Emergency Powers COVID-19 Regulations number 24 of 2021 replaces the previous Public Health Restriction of Movement Regulations number 17 of 2021 and runs from June 15th to June 26, 2021. Many of the provisions in this new regulation are similar to the provisions of the previous regulation. However, there are some new provisions, and I will now highlight some of the similarities and the new provisions. A period of night curfew is imposed every day from 6 p.m. on one day until 5 a.m. the following day, commencing on June 15th, 2021, and ending 11:59 p.m. on Saturday, 26 June 2021. During the period of night curfew, every person shall remain confined to his or her place of residence, inclusive of your yard space, to avoid contact outside of your family, except essential workers who are required to report to work or for essential travel for medical emergencies. All essential workers shall at all times carry personal identification or official work identification where possible. Between the hours of 5 a.m. and 6 p.m., every person shall remain confined to their place of residence, inclusive of your yard, to avoid contact outside of your family, except essential workers who are required to report for work, workers required to work in any of the businesses authorized to operate, essential travel for medical emergencies, or to access the businesses authorized to operate. I repeat this, it is very important. Between the hours of 5 a.m. to 6 p.m., every person shall remain confined to their place of residence, inclusive of their yard space, to avoid contact outside of their family, except essential workers who are required to report for work, workers required to work in any of the businesses that are authorized to operate, for essential travel, for medical emergencies, or to access the businesses authorized to operate. Now, the following businesses are allowed to operate on a limited basis between the hours of 5 a.m. and 6 p.m. So these are the businesses that you are permitted to access their services during the period 5 a.m. to 6 p.m. Bakeries, supermarkets, pharmacies, private medical facilities, banks and credit unions, approved hotels or approved quarantine facilities, approved COVID-19 taxi operators, approved COVID-19 ferry operators, motor omnibuses, or any motor vehicle for hire or reward in accordance with the provisions of the COVID-19 Act, gas stations, courier services, and such other businesses or undertakings as may be expressly approved by the Commissioner of Police in writing. A business referred to above shall only be allowed to operate where the employees of that business can practice physical distancing and hygiene protocols in accordance with the provisions of the COVID-19 Prevention and Control Act. There shall be no in-dining in restaurants, bars, or food trucks. Restaurants, bars, and food trucks may operate only for the purposes of food delivery or food takeaway services where the employees of that business can practice physical distancing and hygiene protocols in accordance with the provisions of the COVID-19 Prevention and Control Act. Now, that was a provision of the previous regulation, and it is now provided for in this new regulation. Now, this provision that I'm going to speak to is a new provision for this Emergency Powers Act. Notwithstanding the provisions of the Liquor Licenses Act, all retail liquor licenses are suspended. So this is new. All retail liquor licenses are suspended. Public beaches, no person shall visit a public beach on the island of St. Christopher except with the written permission of the Commissioner of Police. All businesses and offices shall continue to their operations by allowing their employees to work remotely from home utilizing virtual means, unless those employees are permitted to work under or as being designated as an essential business. I repeat that. All businesses and offices shall continue their business operations by allowing their employees to work remotely from home utilizing virtual means, unless those employees are permitted to work and are designated as being essential businesses. All these measures are public health measures intended to control and prevent the spread of the virus, and we therefore ask that you see them in that light and give us your full cooperation as we fight this disease. Thank you.
I recognize the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. I now invite the Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center, Committee Situation Report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee's situation report for Wednesday, June the 16th. The SARS-CoV-2 or the COVID-19 virus has been reintroduced into the Federation. It's circulating, and at present we are trying our very best to contain the current wave of COVID-19 cases. This wave was recognized on May 19th of this year, so that's about 4 weeks ago. And between then to present, we have added 206 cases to our COVID-19 tally. But let me just break this down. So for today, Wednesday, June the 16th, we have received results for 7 cases. Can I have the slide? Yes, for today, June the 16th, we have received results for 7 cases. So we've received positive results for 7 cases. Yesterday, Tuesday, June 15th, we received results for 18 cases. On Monday, we received 17 positive results. On Sunday, we received 9 positive results. Last Saturday, we received 13 positive results. So if you look on the slide, on the graph on the right, you see the actual number of cases returning positive results per day over this past week. And so you realize there was a peak last Friday, the 11th of June. And so let me repeat. We've added 206 cases to our tally over this past 4 weeks. I just broke down the number of cases we've added per day over the past week. To date, so at present, we have 186 active cases. 186 active cases. We've had 20 recoveries during this time period. 20 persons have fully recovered over this time period. And also, during this time period, we've had a total of 13 hospitalizations. 7 individuals have since been discharged, stable. And so at present, we have 6 cases in hospital. 1 in particular is experiencing moderate COVID-19 disease. And so the cadre of case managers monitoring these 186 active cases. They are monitoring them closely, and we are trying our best to have all of them recover as has been our experience so far. Now, this slide provides us a summary of the status on the ground. So this is the total number of cases broken down. So the Federation thus far records 251 cases, 236 St. Kitts, 15 recorded Nevis. To date, meaning between last March to present, 65 cases have fully recovered, and as I said before, 186 active cases in isolation, and they are being monitored closely by the team of case managers. As I said before, there are 6 persons presently in hospital. All right, so this slide is this slide is quite new. We just developed this tile or slide. We want you to get accustomed to it because this would be our daily bulletin. At 6 p.m. every evening, we hope to update this slide and disseminate to the public providing you timely updates regarding the COVID-19 situation on the ground. And so you see in the left-hand column, total number of confirmed cases within the last 24 hours, 7. So today, we've received results for 7, positive results for 7 cases. So that would be the first row, first column. And then on the right-hand side, you see the total number of cases, 251. So that's the cumulative total. And then you will be told the number of active cases, 186, the number of cases recovered, 65, and then we'll have the breakdown across the Federation, 236 cases on the tally for St. Kitts and 15 cases on the tally for Nevis. And then we have the number of negative results and deaths and the world figures down the bottom. And so, ladies and gentlemen, this would be the tile that would be submitted, disseminated at 6 p.m. every day, updating you on the COVID-19 situation on the ground. Okay, so what's the way forward? So what we are doing is utilizing the public health measures or tools to help us to flatten this curve as we did last year. And so we are using contact tracing, we are testing, we are continuing our COVID-19 vaccination rollout, and then the restriction you just heard about. So these are the public health interventions, the public health tools that we are utilizing to contain this outbreak. Our contact tracing process has been successful to date because most of the recent cases that we've identified, we have done so through the contact tracing process. And because we have picked up these cases as soon as we have actually prevented a significant number of cases by just contact tracing alone. So to date, the team, we have engaged 1,887 persons. We've officially released 1,238 persons from quarantine, and so we have 649 individuals remaining. And so our contact tracing process continues. Testing, that's another tool that we are utilizing. So we are testing our cases, we are testing their contacts, and we are also conducting targeted testing in communities in order to prevent clusters in different geographical areas. And so we will continue doing so. Within this last 4-week period, we have tested over 5,633 persons. In essence, we have tested about 11.9% of the total population within this short space of time. And so this is good, and we will continue. We continue our COVID-19 vaccination rollout. And so, again, we started our vaccination program in February, so it's almost 4 months. And within this short space of time, we have attained these the following coverage rates. So 66.3% of the target population have been covered with the first dose of the AstraZeneca Oxford vaccine, and 31% of the target population is covered by the second dose or fully vaccinated. So in essence, 10,255 nationals or persons in the Federation are now fully vaccinated. And so when you compare St. Kitts and Nevis with the neighboring islands that make up the Eastern Caribbean Currency Union, we are doing quite well in terms of our COVID-19 vaccination rollout. And so we will continue, because the more persons we have vaccinated, the greater the proportion of individuals who who would have had acquired immunity, and this in and of itself would help to break the chains of transmission of the virus as we speak. So this is very, very important. I also want to utilize this opportunity to remind our breastfeeding and lactating women that you are able to come on board and accept this vaccine. The scientific information tells us that it is safe for breastfeeding women to take this vaccine. Let me just underscore, it is safe for breastfeeding, lactating women to take this vaccine. So very, very important. I also want to remind those who have already gotten their first dose. We want you to look at your card, note your appointment, and if more than 4 weeks or 5 weeks has elapsed between your first dose and present, you can indeed come in earlier than the date on your card and get the second dose of your vaccine. We are actually encouraging that. So we are encouraging persons who have gotten their first dose, you can come in to the nearest health center and get your second dose even before the appointment that is indicated on your vaccine card. Once at least a month, that's 4 to 5 weeks, has elapsed between your first dose and present. So this is very, very important. Now, in terms of the restrictions, the strict restrictions that have been announced, the principle behind this public health intervention, yes. So restrictions or restricting the movement of individuals is actually a public health intervention that is employed during an outbreak, or it's a public health intervention that can be employed during an outbreak. The principle behind this intervention is that it reduces social interaction and it breaks the chains of transmission of the virus. And we are hoping and we expect that with this measure, we will be able to reduce significantly, reduce the number of positive cases that we are seeing. But I want us to note that the effectiveness of this measure also depends on our adherence to the non-pharmaceutical measures during the period of lockdown. And so even though your movements, is restricted, we want you to still remember the importance of wearing your face mask, sanitizing your hands, and maintaining that distance in your own social network. So this is a very important point that I wanted to highlight this afternoon. Those of us who are virus-free, those of us who have not been diagnosed with COVID-19 to date, I want us to do all we can to prevent exposure to the virus. We need to protect ourselves from this virus that is in circulation. How can you do so? Well, one, by accepting the vaccine. So if you're not vaccinated, if you have not yet come on board in terms of accepting the vaccine, we want you to do so. And then we want you to wear your face mask at all times. So now I'm very comfortable in wearing my face mask. Once I step through my front door, it's on until I get back home. So you need to wear your face mask at all times. Maintain hand hygiene. So I have hand sanitizer. I have soap and water in my car to wash my hands. Yeah? The ladies at work laughed at me, but that's how serious I am in terms of maintaining hand hygiene. Physical distance, some persons, may think you whatever, but you need to maintain that distance whenever you're in the public spaces. For example, if you're going to the supermarket or the pharmacy, you need to maintain that physical distance. And it's only, so right now, over this 2-week period, we are supposed to be sheltering in place. You only leave home if it's an essential errand or task that you are going to complete. If you have been diagnosed with COVID-19, we want you to do your part and not pass on or spread the virus to your loved ones, to your family members, or to anyone for that matter. So if you have been diagnosed with COVID-19, so if you are one of our active cases, we want you to do all you can and not pass on or spread the virus to anyone, okay? We also want you to boost your own immune system. We also want you to recover speedily. And so we would implore that you eat healthily. So that's fruits and vegetables, smoothies, made from, the same fruits and vegetables. Maintain adequate hydration. Make sure you drink enough water. Of course, you must rest. And then there is exercise. You can do push-ups or abdominals, whatever you like. So exercise is still very important, even while in isolation or self-isolation. And then, of course, you have your multivitamins and supplements. So these are some of the things we want you to do in terms of those of you who are, recovering from COVID-19. I want to speak to the contacts of the COVID-19 cases. So if you have had contact with someone, a loved one, a co-worker who is now diagnosed with COVID-19, we want you to stay at home. Yes, stay at home. So if you are a contact of a recently diagnosed COVID-19 case, if it's your coworker, if it's a loved one, and you have had significant contact with that individual, we are asking you to remain at home and to self-quarantine for 14 days after your last contact with that individual who is now diagnosed with COVID. So that's your self-quarantine period, 14 days after your last exposure to the individual. And then during this period, and especially or particularly at the end of your self-quarantine period, you must be tested. So that 14 days post-exposure test is critical. If that test returns negative, it means you are cleared and you can be officially released from self-quarantine. If you are not yet certain about your testing date, or if you've not yet received a test, you can call 311 and seek advice regarding testing. Now, if you are fully vaccinated and you have had contact with a known COVID-19 case, you also require a test. And so we recommend that you complete your COVID-19 test 7 days post-exposure to the COVID-19 individual, or the individual with COVID-19. Protect yourself against COVID-19 by following the well-known prevention and control measures. And most importantly, if you have not yet come on board regarding the vaccination, do not wait any longer. Vaccinate. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdia Samuel, the chair of the National COVID-19 Task Force and National Disaster Coordinator at NEMA, to address us.
Pleasant good afternoon, all, and thank you, Mr. Williams. To all of you who are watching via all media platforms, television and radio, listening via radio. Welcome to update you on a number of matters regarding our response to this particular crisis. One, the Ministry of Tourism and Tourism Authority has indicated that due to the restriction of movement that has been implemented, the port of call that should have been today, Wednesday 16, by the Celebrity Millennium has been delayed until further notice. The situation remains fluid, and we anticipate that we will have an update for the general public by Wednesday, 23rd June 2021. So for all the persons who were asking about the cruise ship, the Ministry of Tourism and Tourism Authority has advised on the instructions of the Federal Cabinet of Ministers that we will have to delay its arrival. The Ministry of Education has implemented a number of measures to carry out a number of examinations in the subjects of food and nutrition, clothing and textile, French and Spanish orals, and music. In this regard, they have been carrying out these activities, and I am appealing to the parents and the students to be responsible in providing the information to the Ministry of Education officials as per your status, and also to adhere to the protocols. We want you to be safe, we want you to do good in your exam, but you have to also acknowledge that the environment that we're in requires full cooperation and adherence to the protocols. So again, let me inform you that all schools are closed to visits from parents and members of the general public. Again, all schools are closed to visits from parents and members of the general public. We are also, again, advising individuals, if you want to source information with reference to our response, please visit the SKNIS website at www.sknis.kn, the COVID-19 website, www.covid19.gov.kn, and you can also visit the Ministry of Health Facebook page. You can also visit the NEMA website and NEMA Facebook page at www.nema.kn. We will be providing you with up-to-date information regarding our response. Ladies and gentlemen, I have over and over informed you and kept you updated as per our social protection assistance that has been provided to persons who have been placed in quarantine or in isolation. Case in point, to date, I was informed by the Permanent Secretary for Social and Community Development, Ms. Lewis, that to date they have provided on a daily basis for the past 7 or 8 days 39 meals to persons, hot meals that is, to persons who are in quarantine, and for persons who are at home, some 618 plus persons have benefited from this program. So I am appealing to individuals, again, if you have those needs, please contact Social Protection Assistance for such services. We have seen that the Atlantic Hurricane Basin has been showing some activity, so it's starting to indicate to us that we have to continue our preparedness measures. So in this regard, I am appealing to individuals to continue to prepare for the, to continue to prepare as we are reaching the peak of the hurricane season that starts at the end of August and goes through to the mid-October. So please continue to prepare so that we can be resilient in this dual hazard environment that we have at this moment. With that said, I want to thank you for tuning in, and we will welcome your questions.
Thank you, Mr. Samuel, and thanks to all the presenters. The first question is, why a state of emergency? What's the difference between the state of emergency and the COVID-19 Prevention and Control Act? Isn't that sufficient?
Thank you very much for that question. The COVID-19 Prevention and Control Act 2020 at section 26 speaks very clearly to, and I read, the heading is curfew and closure of borders, and while there is no closure of any border, a curfew may be imposed or borders may be closed for the purposes of the prevention, mitigation, or suppression of the spread of COVID-19 in St. Christopher and Nevis in accordance with regulations made by the Governor General under the Emergency Powers Act. So the COVID-19 Prevention and Control Act 2020 requires that we ask the Governor General to do so under the Emergency Powers Act. That is basically the reason we have done.
Thank you very much, Attorney General. These other two questions are from Win FM 98.9. What variant of COVID-19 do we have in St. Kitts and Nevis? How are prisoners that tested positive for COVID-19 isolated?
As I said in my presentation last night, the Ministry of Health sent off samples to two shipments of samples to the Caribbean Public Health Agency in Trinidad. And so we are presently awaiting the results from genomic sequencing evaluation that we are expecting to be conducted on these samples. So at present, we are unable to, tell you emphatically which variant is in circulation because we are waiting the results from the genomic sequencing exercise. The samples have been shipped already. Now, in terms of the outbreak in the prisons, to date, I think we have 9 inmates who have been found positive with COVID-19, and so they are isolated in cells separate and apart from the other prisoners at the back of Her Majesty's prison. So the positive cases have been isolated from the rest of the prison, and the implicated cells where they were have been professionally sanitized. All right, so those who are positive have been isolated, and the implicated cells have already been professionally sanitized.
Thank you. This next question, if, as we have been told time and time again, persons who are fully vaccinated are at little risk of contracting or transmitting a severe case of COVID-19, what is the rationale for restricting the movement of fully vaccinated persons in the same way that unvaccinated persons are being restricted.
Just before I answer that question, I just want to give a follow-up on the prison, because we keep saying with choices come consequences. And very early, we attempted to vaccinate everyone at Her Majesty's prison. There are some persons who refused. There are some family members who said that they did not want their relatives to be vaccinated. We were hoping to have everyone at an institution like that vaccinated, so that when community spread occurred, we would not have the situation that we are in now. There are a number of persons who did not want their family members to be vaccinated. There are a number of persons there who did not want to be vaccinated. And now you hear we have an outbreak in the prison. And just today or this week, the United States passed the 600,000 number of persons dead after having recorded their first death in February 2020. And the majority of these persons who are dead are persons who were not vaccinated. So I want to encourage persons. The vaccination saves lives. The question was asked, why are we restricting the movement of the unvaccinated with the vaccinated? Yes, we know that being vaccinated, it decreases your risk of severe disease, it decreases your risk of death, and it also significantly decreases the chance of you transmitting the virus. We kept saying, though, that we have to look after the country as a whole, and until we reach a place where a significant proportion of the population is fully vaccinated, the persons who are vaccinated can still be a risk to those who are not vaccinated. As of 5 o'clock this afternoon, we had 66.6% of persons who had their first dose, and 31% who were fully vaccinated. We are hoping that by the end of this month, we would have 66% of persons fully vaccinated, and then we can start making decisions where we know that the majority of the persons are fully vaccinated, such that whatever decisions we make in relation to the vaccinated persons, we would have a smaller percentage of persons who are not vaccinated, and that would not overwhelm our health system. And so we have to think about our healthcare system when we are making these decisions. It's also important to note that without a vaccination passport, one cannot determine who is vaccinated and who is not. And so we have to have a broad policy to stop the movement of persons, because by stopping the movement of persons, we are stopping the movement of the virus, and anyone, whether you're vaccinated or not, can cause the virus to move.
Thank you. There are businesses that have succeeded in encouraging their staff members to get both vaccinations, so that their entire staff is fully vaccinated. Some of these businesses are non-essential businesses, so the employees are not making their weekly earnings during the current lockdown period. These fully vaccinated employees feel that they are being penalized, even though they did their part in going to the clinics and getting their vaccinations in a timely manner. Will these and other employees be eligible for some form of relief for lost earnings from Social Security?
Thank you, Mr. Williams. St. Kitts and Nevis is in a crisis, and at this point in time, the state of emergency is mandated to ensure that the country gets a chance to reset, for the medical fraternity to bring us under control. We expect that we hope that this would happen over the incubation period, and that by the 26th of June coming, we would be able to then get further advice as to what to do. The government will consider and look to see what areas we can to support and help those who may feel disadvantaged, but it is a decision that will have to be made by the cabinet. At this point in time, there is no such decision, but we would want everyone in St. Kitts and Nevis to support the health fraternity as we try to restrict the movement of the virus. It cannot be helpful if we have dozens of people continuing to get the virus, to have to stay at home, and those businesses where people are unvaccinated having to be closed down as they have the questions of those who would be in the same space as those who are positive have to then be placed in quarantine to be tested so that they cannot further transmit it. Thank you.
Can someone shed some light on the letter that is supposed to be given to you to take to your workplace to say that you are in quarantine?
Thank you for that question, Lezoy. If I understood correctly, you were saying that the person was asking whether or not they would be given a letter to verify that they have been duly placed in quarantine, or I guess isolation as the case might be. Right. That is a matter that we would have discussed in this very room several weeks ago at a meeting of the Prime Minister's press conference, if I recall correctly. And at that time, I would have indicated that the Social Security Act does speak to a situation like that. If I recall, it is found in Schedule 8, Part 3, subsection 9.2, and that states clearly that the Chief Medical Officer, precisely as the quarantine authority, has within her powers the ability to remove an individual from the general population in the interest of protecting health and safety, including but not limited to the health and safety of the very person too that naturally is being removed. What was agreed, based on an agreement between the Social Security Director, also the Minister with responsibility for Social Security, the Honorable Eugene Hamilton, the Attorney General's Chambers, as well as the Ministry of Health, is that a letter would be prepared which verifies that an individual has been placed in quarantine by order of the Chief Medical Officer. That letter is already designed, just about to be gazetted, and it would state the Social Security number of the individual, where they work, place of employment, etc. Copy directed to the Social Security Director, as well as the Labor Commissioner, and signed, of course, by the Office of the Chief Medical Officer, indicating that the person has been duly placed in quarantine and from when. By extension, also soon to be gazetted, is a quarantine or isolation release certificate that essentially states by the Office of the Chief Medical Officer that the person would have satisfied the period of quarantine or isolation, and in the case of the latter, meaning isolation, that they would have fully recovered, and that in either case, be it isolation or quarantine, that individual is now certified as being fit to be reintegrated into the general population. When that happens, Mr. Williams, it's simply a case of having the information completed, because both documents are written out in the form of a letter, fill in the blank type, and in that particular case, then that letter is taken to the employer, again, with copy to the Director of Social Security, as well as the employer and also the Labor Commissioner. And in a case like that, once it is certified, that will be treated, the period of quarantine or isolation will be treated in the same respect as would the period of illness that you would naturally have. That would guarantee that 65% of your wage would be payable to you for that period that you were out of work. Now, I should step back a little further and indicate that in some cases, there are employers, and the Labor Commissioner's office would have issued a public advisory to that effect, where some employers, based on company policy, might make a decision that the remaining 35% that the employee is not necessarily entitled to by law, they will nevertheless make up the difference so that that person is not out of pocket. However, I should state that that is not the law. It is mainly a convention, or perhaps out of compassion, that some places of employment would do that.
Thank you, Minister Phipps. This next question, are we thinking of applying monitoring bracelets to people in quarantine like Barbados does with BIMSafe?
Yes, consideration is being given for the use of electronic bracelets to track or to monitor persons who are placed in home quarantine. Provisions are made for this in the COVID-19 Act, and we are presently exploring these devices.
This question is from WinFM for the Attorney General. Can you explain the regulations for Nevis as it relates to weddings, funerals, and places of religious instruction, as nothing is mentioned in the SR&O 24 of 2021 for Nevis and only for St. Kitts?
Thank you, Mr. Williams. And I believe that the WinFM may not have actually perused the SRO 24 for 2021 fully. The SRO has in it 4 parts. Part 1 is a preliminary part that deals with questions of interpretation and the duration of the emergency regulations. Part 2 is headed Emergency Measures for the Federation of St. Christopher and Nevis. Part 3 looks at emergency measures for the island of St. Christopher. And Part 4 looks to regulations in relation in emergency measures for the island of Nevis. So there are, whereas there are regulations for the entire state, questions of curfew, the night curfew, questions of safety protocols, no mass gatherings, the suspension of liquor license, and questions in terms of restriction of regional and international travelers. When it comes to the question of measures for the island of Nevis, these are somewhat modified, somewhat slightly modified, and one of them is, I think you asked about beaches. And I'll read for that. A person may visit a public beach only for the purposes of swimming or exercise, and the following restrictions shall apply. Where there shall be no picnics, beach parties, or other gatherings, and B, all persons shall adhere to social distancing, physical distancing protocols pursuant to the provisions of COVID-19 Prevention and Control Act. So there is a modification as regards Nevis in terms of the visit to public beaches. Thank you.
Thank you, Attorney General. Are fully vaccinated people who have been exposed to the virus, do they have to self-quarantine? And if so, for how long? Are fully vaccinated people who have been exposed to the outbreak, do they have to self-quarantine? And if so, for how long?
Very good question, Mr. Williams. And so if you are a contact of a case and you are called by the contact tracer from the Department of Health, they're going to ask you if you're fully vaccinated. They're going to take the data, your first dose, second dose, and if 2 weeks had passed. And so once you are fully vaccinated, you will be told that no, you don't have to self-quarantine. However, you must be tested. As I said in my presentation, you must get that 7-day test, meaning 7 days post-exposure to the case, you must be tested. And if that test is negative, you're good to go. But the answer is yes, you do not have to quarantine.
Thank you, Dr. Laws. This brings us to our last question for the day. I understood Dr. Laws to have said in her presentation today that if one who has been fully vaccinated is thought to have been exposed to an affected person, then the fully vaccinated person should be tested after 7 days in quarantine. If this is so, why then do persons who travel to the Federation who have been fully vaccinated are required to spend 9 days in quarantine and not a much shorter period?
First of all, let's make sure we understand the difference between a contact and a significant contact, because when someone tests positive and they would give the names of the persons who they would have come in contact with, part of the responsibility of the contact tracing team is to see whether or not this was a significant contact. And so it doesn't necessarily mean that everyone you would have passed in the supermarket or driven on public transportation, that person would have to be quarantined. A significant contact refers to face-to-face contact for at least 15 minutes. And so if you were fully vaccinated, if you were wearing a mask, and if you were at least 6 feet from someone, even if you were in the same common space with someone who tested positive, it doesn't necessarily mean that you were at risk. Now, in the question that the person asked about the vaccinated person who's coming in and why they have to be quarantined for 9 days, again, that's a very good question, because we have to understand that this is an ongoing or very mercurial situation that we're dealing with, and we keep reevaluating where we are and adjusting their protocols. And we said very soon, hopefully at the end of this 2-week partial lockdown, we will be making adjustments to our quarantine period for the incoming vaccinated traveler. So all we ask is patience.
Thank you, Dr. Wilkins. So that brings us to the end of our question and answer segment. Thank you very much for the questions that you posed. And next briefing, if you do have questions, please submit them and we will answer. I want to thank the chief players today, the Attorney General, Honorable Vincent Byron Jr., who explained to us what a state of emergency is. Additionally, we thank Superintendent Cromwell Henry for explaining the new regulations, the SR and O's. Our Chief Medical Officer, Dr. Hazel Laws, for presenting us with an update on the Health Emergency Operations Committee Situation Report, and Mr. Abdias Samuel, Chair of the National COVID-19 Task Force, and the National Disaster Coordinator at NEMA for his presentation. Additionally, I want to thank for their support here at the NEOC, the Honorable Prime Minister, the Honorable Timothy Harris, who is here with us today. We also thank the co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps. We also have with us the Commissioner of Police, Mr. Hilroy Brandy. We thank Mrs. Christmas Jacobs for her continued service of sign language to a very special group of people among us. And we thank ZIZ for its continued service in bringing these press briefings live, John James and his crew. And we thank all who are a part of the National COVID-19 Task Force and all who continue to support us here at the National Emergency Operations Center for these briefings, and who continue to play their part in adhering to the non-pharmaceutical measures, those of wearing the mask, the hand hygiene, and the social distancing, and those, of course, who continue to avail themselves of the pharmaceutical measures, that of taking the vaccine. Today, on my program, Working for You, we had Mr. Connor, who is the acting director of the Department of Probation and Child Protection Services. And the discussion basically was about the protection of children during the pandemic. And one of the things that actually came up is that in order to protect our children, the adults must be vaccinated. The adults are the vaccine for the children. Normally, children would get vaccine when they're very young. But in this case, the vaccine, the Oxford AstraZeneca vaccine, has not been tested on people under 18, and so it cannot be administered to people who are under 18. And so therefore, it is the vaccinated that must protect the unvaccinated, and in this case, it's our children. They're vulnerable and they're unprotected. I cannot understand any parent who will refuse to take the vaccine knowing that they have young children. I don't understand it, because your children must be yours to protect and care for. So therefore, you have an ethical and moral responsibility to care for your children. That brings us to the end of our press briefing for today. We will be back at some other point. Until then, take care. I am Les Roy Williams.